Hello, in this video we will discuss about the gallstone. So what is the gallstone? Basically there is a different type of gallstone are present in the gallbladder which that give the complication and changes the physiology. So it can be mixed stone, cholesterol stone, pigmented stone, or gallstone. Basically other types, mixed stone, pigment stone, and the cholesterol stone, and this is basically the type. And to increase the bilirubin, so the gallstone block the bile duct to increase the bilirubin in the circulation, cause jaundice, increase the cholesterol also, so it cause jaundice. Jaundice is the disease which that is occur due to other complication, but in this case we are understanding the gallstone. So the cholesterol and glucose can enter into the liver. So this is the liver and this is the gallbladder, which that contain a bile duct used for the excretion of bile pigment into the intestine. So the symptom is the yellowish color, skin, and the abdominal pain, which that is the major cause for the gallstone. And if the gallstone are present in the gallbladder, so the upper abdominal pain, while here you can see this is when blocking the pancreatic duct and common bile duct, which that will lead to lower abdominal pain. So this is the gallbladder, which that contains stone, and stone can be moved into the, here is the blocked cystic duct and common bile duct and pancreatic duct, which can be blocked, which that will give the result we will discuss. So this is the duodenum. So the hypercholesteremia will occur because the extra cholesterol will not excrete, while the hyperbilirubinemia, which that is due to the bilirubin excretion inhibition, and the indigestion also occur due to the amylase, chymotrypsin, and trypsin, which that will not release from the pancreas. So the protein carbohydrate digestion will inhibit. So the arteriosclerosis and high blood pressure. Why? Because the hypercholesteremia can be possible, and the jaundice, infection, and skin changes due to the hyperbilirubinemia, which that gives the yellowish color of the skin, and the indigestion due to the bile emulsion, and the amylase will be stopped from the pancreas. So the exocrine hormone released from the pancreas will inhibit due to the stone inhibition. The stone will block this pathway. So the pathophysiology of gallstone, let's begin to understand. So this cholesterol stone, which that will trigger the supersaturation of the cholesterol in bile, and that is why, because the hypercholesterol, which that will lead to also the supersaturation of the cholesterol in bile, which that will lead to cholesterol stone. So this is the type of cholesterol stone. And intestinal hypomotility. On the other hand, the Western diets, high intake of sugar, iron, and vitamin C deficiency also, and obesity and weight gain, pregnancy, oral contraceptive, and diabetes and liver disease, which that will lead to cause the cholesterol stone. While on the other hand, the crystal formation will occur by these cholesterol stone, and this crystallization formation like arteriosclerosis, same mechanism. On the other hand, the reduced bile salt excretion. When reduce the bile salt excretion by other complication will lead to cause the crystal formation, and this crystal formation is the precursor of gallstone formation. So this reduction of bile acid, bile salt and bile acid excretion, weight loss, and on the other hand the chronic inflammatory disease, bile acid diarrhea, and the chronic diarrhea, and environmental factors also involved for this function, for this production of crystal formation. So the environmental factor can be a metal or other ions. So remember, So these two basically is the factors containing which that will lead to crystal formation. This crystal formation is immature stone which that will be mature by the reduced gallbladder motility. So the gallbladder motility when reduced, which that will lead to cause the gallstone formation. On the other hand, the prolonged fasting, which that is also occurred due to the ketoacidosis and other problem, and cholesterol will excrete due to the hypercholesteremia, and the vagotomy, the octreotide, and reduce the anti-nucleating factors in bile and enhanced nucleation of cholesterol crystals and trace and heavy element, which that will lead to trigger the crystal formation to conversion into the gallstone formation. So remember that things. And in this way, let's begin to understand the mechanism from the crystal formation to the mature gallstone. So in this way here you can see this is the gallbladder which that's contain crystal formation, and this crystal formation here is the gallbladder which that is containing the bile pigment, the bile acid and other things. So the trace and heavy element in bile juice, for example calcium, iron, oxalate ions, and on the other hand other heavy elements which that will lead to collapse together, the which that combine together to form a compounds, also calcium carbonate, which that will lead to gallstone. And this gallstone formation after the crystalline formation will lead to blocked crystal duct and common bile duct. So it can be blocked, and here is the gallstone when moved toward the blocked crystal duct. So here you can see the common bile duct and the gallstones. So in this way, here is the pancreatic duct are also present, which that is the pancreas will excrete, which also can block. On the other hand, the pigment stone. What is the pigment stone? So the pigment stone and the mixed stone we will discuss. So the excess bile production and hemolytic anemia will produce more iron and bilirubin, which that and also the cirrhosis and the biliary tract infection, which that will lead to pigment stone because the excess bile production and hemolytic anemia. On the other hand, the mixed stone is the formation from the cholesterol crystal first, and other debris will lead to same as cholesterol stone, but further going on the bacterial colonization will lead to bilirubin deconjugation due to the bacterial activity, the glucuronidase enzyme, which that will lead to unconjugation to work for this, and in this way the bilirubin will not conjugation. So here is the formation of the cholesterol and phospholipids, which that is the uni and the multimalar vesicle, which that will be formed, and the mixed micelles. This mixed micelle is the bile salt will trigger by this mixed micelle. After this, the cholesterol crystals formation will occur and the gallbladder stasis will be formed. And the pronucleators mucin, for example, which that also trigger the cholesterol crystals. So these are the cholesterol crystals which that convert into the cholesterol gallstone, and on the other hand here is the gallbladder stasis which that will trigger the cholesterol crystal, and in this way here you can see the cholesterol gallstone formation from the cholesterol crystals, and that was the precursor of the gallstone, cholesterol gallstone. On the other hand, the mixed gallstone formation due to the bilirubin diglucuronide, and bilirubin when diglucuronide will lead to bacteria enzymes work to produce the calcium bilirubinate will lead to mixed gallstone and also the pigment gallstone formation from this. So anyhow, this is the formation of the stones by this mechanism. While the stones can be different type, again I am understanding to you the gallbladder stone and the intrahepatic bile duct stone and extrahepatic bile duct stone. So first of all, we should need to understand the gallbladder stone. So the cholelithiasis, that is the term medical use, the gallbladder stone, and containing the cholesterol or black pigment. On the other hand, the intrahepatic bile duct stones, which that will lead to hepatolithiasis, contain brown pigment and cholesterol stone. On the other hand, the extrahepatic bile duct stones, which that will lead to cholelithiasis, the primary stone, whereas the secondary stone are mainly cholesterol stones. So, on the other hand, let's begin to understand the diagnosis, how to check and how to identify the stones. So, how it work? So, the endoscope retrograde cholangio pancreatography cholangiopancreatography ERCP use for it. So in this way, the doctor will enter the camera through a wire, which that move directly into the stomach from the esophagus to move into the duodenum, where the bile duct are present and the pancreatic duct are present. So it can be enter into the, here you can see this, I will explain again. This is the liver, stomach, pancreas, and this is the duodenum. So this remember, this is the gallbladder. So it will be transferred into the stomach to the gallbladder by this mechanism, you can understand. So for identification through camera, to identify the gallstone either present or not. So that is the gallstone formation, the pathophysiology, pathogenesis of gallstone formation. So this video about only the gallstone and their diagnosis, and we had not discussed about the removing of the gallbladder, but you can understand in this video. So thanks for watching. Bye.